In this case, we're going to identify one of two waveforms that you could use, one of which is Symmetrical Biphasic Waveform or the NMES waveform, which stands for Neuromuscular Stimulation. In this particular case, we're going to use the Symmetrical Biphasic Waveform. This treatment approach is based on the research that was done by Stevens-Lapsley in 2012. This approach leans on this idea of high-intensity NMES after total knee replacement. The mechanism of action is to try to overcome neural inhibition in the quadriceps and activate the weak inhibited fast-twitch muscle fibers to prevent atrophy. The clinical example here today is a post-op total knee at 60 degrees of flexion. As you can see with the patient, we're seated in a stationary chair. We have a belt that is wrapped around the frame of the chair, around the patient's front of the ankle of the patient, and with the involved leg, the total knee, with a cushion to prevent any kind of knee extension as we increase the current up to the maximum tolerable contraction. We really want to focus on getting a nice tenonized contraction out of the quad muscles in this approach. When we talk about dosing the intensity, there's some considerations here to think about. One of which in the research suggests to, if you've got the instrumentation, dynamometer for example, to test the uninvolved leg to create a maximum volitional contraction as a baseline, then the goal would be to utilize the waveform, the unit, and the current to get it equal to or greater than 50% of that maximum volitional contraction in the involved leg. If you don't have that capacity, then you're going to just use the unit, increase the intensity to the maximum tolerable contraction by the patient, and ensure that you don't have any muscle fasciculations. We want a nice tenonized contraction of those quads, and then it'll run through its cycle time. This is how you set up the protocol for this treatment. Select electrotherapy, manual operation, the biphasic waveform and symmetrical biphasic. We want to select the appropriate channel that you're using. And with this one, we're going to utilize a frequency of 50 pulses per second, a phase duration of 200 microseconds, and a cycle time of 15 seconds on and 45 seconds off. Now we're going to go through a treatment application. The unit is already set up with the symmetrical biphasic waveform with the appropriate protocol parameters that were used in the research in 2012. All I'm going to do now is actually touch the amplitude on the screen. To highlight it, I'm going to increase the amplitude, and I'm just going to simply ask the patient to go ahead and give me an indication of when he feels the stimulation, the tingling sensation. Now I'm going to keep going. I'm going to look for motor activity out of the muscle. We'll see some muscle fasciculations now. Now we're looking for a nice strong contraction that's tolerable for the patient. Okay, now that's tolerable enough for him. We can see a nice contraction of the quad muscles really standing up there. We simply hit the start button at that point and allow it to cycle through a 15-second on and a 45-second off period. Some key clinical comments or considerations with this approach is to utilize electrical stimulation to weak inhibited muscles within the first 48 hours post-op to get the maximum benefit of the kind of outcomes that you could achieve, and to do that up to 4 to 6 weeks post-op. Studies also show that using NMES protocols added to the plan of care with quadriceps strength is greater than exercise alone.